Good afternoon. My name is Ishmael from Innovarx, founder and CEO of Innovarx Global Health. Just a little bit of background about who I am. I'm a pharmacist by training, spent over a decade in community pharmacy in both rural and urban North Carolina. But my family's lived in 6 different countries around the world as a son of an ambassador. So I think healthcare from day one has always been a picture of the haves and the have-nots. And when on the side of have-nots, my grandmother was one of them who I didn't get a chance to know. She died at the age of 56 from diabetes and hypertension. And her story is not unique to our family. It's the story of the entire continent. Currently, my mom lives with diabetes. Her outcomes are a little bit better because she has a son who's a pharmacist in the US. I'm also a hypertensive, so I understand critically how important it is access to quality healthcare. So what we decided to do is find out solutions that we could put across the continent and form the Healthcare Solutions Company in Charlotte, North Carolina in 2015, basically aimed at becoming access equalizers when it comes to healthcare delivery, specifically in Africa. Being that it's an emerging market, a lot of the constraints are important. So what we decided to do was use technology to improve quality of lives. That's the simplest way to define what the company does. And one might ask, why do we do it? Just to give you guys a little bit of background. Gambia, for example, for every 10,000 Gambians, there's only one physician. So you could imagine how difficult it is for you to have access to preventative care. But interestingly about the market in Sub-Saharan Africa as well too, the counterfeit medication industry is $1 billion industry. That has a lot to do with the entire ecosystem being in the hands of individuals who don't understand the value of quality healthcare. Another interesting fact from an economic standpoint is Gambia, as small as it is, over $500 million comes from outside the Gambia into the region. So in as much as the market is considered poor, a lot of the wealthy individuals in Africa live abroad, tend to sponsor the care of their loved ones. Most of that money doesn't stay in the continent because you see the numbers in medical tourism. So we literally built a solution for the pain points for individuals like myself who have sleepless nights because they have a mom at home who might have a chronic condition. So we designed the company to have to be vertically aligned to provide all the services that you need to take care of somebody who has a chronic condition for a very long time. So most people ask, what's our true north metric? Is a subscription care plan model, which is what we designed as well. Just a little bit of history about the Gambia. It was an ideal pilot place. West Africa alone has 300 million people. That's the size of the United States. That's how far we cast that net, but we felt it was important to start in a market that was a little bit more forgiving and manageable. But as small as Gambia is, almost 7% of the population, going back to the remittances, live abroad. So if you look at Africa over the 10 years, this just gives you a highlight of where we're positioning Innovarx to be. We believe we found out a solution that could be a foundation for the largest ecosystem in healthcare, because if you look at where the trends are from a population and an economic standpoint, it's heading in the right direction. So if you imagine a healthy individual and somebody who is sick enough to be hospitalized, healthcare costs tends to be higher to people in the right. As a company, we decided to occupy the space between a healthy individual and somebody who's sick enough, making it more accessible, creating high lifetime values with some of our plans. And we've seen a lot of traction in 2020 alone, earning revenues of $367,000 in our first year of operations. And the fact that we have our own data that we're using to provide health outcomes, we're now amassing so much quality information to make real-time decisions that could truly improve the lives of individuals. A little bit about where we are right now. Up to now, we've raised a little bit of money as well in terms of startup seed money and convertible notes, but we're at a point where now proof of concept is solidified, and we're looking to raise $450,000 currently to kind of fund the company for the next 18 to 24 months, but also need strategic partnerships. A lot of the issues with cost have to do with access to things like insulin, extremely important. So the more strategic partnerships we have in terms of technology and supply chain, the company just stands a chance to be a formidable player in a market that would be where healthcare is moving. Thank you.
Thank you so much, Ishmael. I love the bow tie, by the way. So a few questions coming in from the chat. People want to learn a lot more about what you're up to. Can you tell us about the thought process around all the different services under one umbrella?
Absolutely, that's an excellent question. From the outside looking in, it looks like we're doing too much. And I'll tell you why that's important. If you imagine somebody who lives in the diaspora who basically just wants care that gives them peace of mind, assurance, that's actually what we're selling is assurance. Well, the market is so bare that in order for you to control the quality circle, you have to control all the elements involved. And the best way to describe it is Africa is the point where you could have the best doctor, the best lab, but run into counterfeit medication. So from a healthcare outcome standpoint, the outcome is zero. If you have quality medications brought in from the US, but you have a system that doesn't have the right technology, the outcome is zero. So vertical integration is the only way the company could protect the value that we offer, but also as we spread our wings in the sub-region, it allows a more replicable outcome. So that's how the company is designed to be as agile enough to still keep that value where people at home may not afford it, but somebody paying $760 a year for a comprehensive care plan is cheaper than a plane ticket. So the value proposition remains high.
So who is your main customer and who's paying for the services?
So majority of our customers don't live in Africa, because going back to the amount of money, we realize remittances in Gambia from an economic standpoint accounts for about 16% of the GDP. So for any proposition from an investor, if you look at Gambia or West Africa as in isolation, there's not enough money in the market for a high value product. But if you look outside, like individuals like myself who live in the US, but have loved ones, because the typical characteristics of somebody who does not live in Africa is they send money back home, but they don't spend money back home because they don't have any services. So our model is designed to now allow as many people who don't live in Africa, who have the spending power to spend money on services that's on the equal level as they would receive it in the US.
That's really interesting. How are you reaching those people that you just described, the ones that are sending the money back?
Excellent question. And I think that ties to our team. We were very strategic in who we recruited to be part of the founding team. So much of the activity, the ecosystem when it comes to diaspora exists on social media. So we leverage social media significantly to sell the pain points that we're trying to solve. Our CTO works for a social media company, so we understand the ecosystem that happens, but also having a CFO who understands fintech and remittances, we know the trends in terms of how people are sending money back home. So a lot of the marketing, we actually target where we know the money is there. But interestingly, we found out in 2020 that 40% of our revenue actually came from within the country. Because remember, only 4% of Gambians have health insurance. So now we have engagements from a B2B standpoint where companies see value in our product and are now paying for their employees to receive the quality of care that is more predictable from an economic standpoint. So we're at a 60-40 right now, 60 coming from outside of the continent and 40 from local middle class and high income earners who need high value products and services.
That's very cool. So you're starting in Gambia. Can you tell us how the model scales and grows outside of Gambia? What's the plan for that scaling and growth?
Yeah, absolutely. I think Gambia was the ideal place for to solidify the proof of concept. Gambia actually in West Africa, Gambia has the lowest, it's $500 million last year, but it's actually lower than the other West African countries. So the other countries that we targeted, English speaking, because it's easier in terms of conversion of all the technology as well too, but there's more spending power in these countries. So it's more replicating exactly what we're doing in the Gambia. And from a marketing, start targeting communities in those countries who still have the same pain points that we do. You have a loved one who is sick, who needs lifetime care, but you cannot trust a service that could give them the highest outcomes. So it's literally the same model, but just scaling it up into more sophisticated markets.
Final question here. We talk about leapfrog opportunities in global health. We love the way that you're approaching these challenges. How are you able to innovate in unique ways, given you have this background that's so interesting and dual experiences in the US and the Gambia?
No, absolutely. I think one of the best experiences I had working in community pharmacy, because I realized how technology was shaping community practice, where now instead of a big brick and mortar lab, there's point of care devices that could give you data and clinical information within minutes. So it's actually leveling the playing field where instead of waiting normally 5-10 years for something to arrive in Africa, our company is actually built as a post-pandemic healthcare delivery company because it's fast, it's remote, it's agile, it makes it as convenient as possible. So I think that's where we're hanging our hat on, just leveraging technologies that already exist. Because the interesting thing is rural America faces the same challenges as a lot of African countries. So my experience in understanding how cost influences decisions, it's automatically transferable to a new market that's going to have a lot of attention in the next decade or two.